To a breakthrough in the fight to combat coronavirus. The first at-home antibody tests are now available online from Quest Diagnostics. The tests have the ability to inform you if you've been exposed to or actually had COVID-19 and develop the antibodies to fight the virus. It costs $119 and results take 1 to 2 days. But vigorous testing in hotspots showed that 1 million people are still at risk for dying of coronavirus if no vaccine is developed. That's one theory anyway. Here to weigh in, cardiologist and author of the book Fight Back, Dr. Chauncey Crandall, and Remote Health Solutions Chief Medical Officer, Dr. Jonathan Baugh. Dr. Baugh, I'll start with you today, sir. Should we go out and get these tests? Are they reliable enough that we should use them?
Thanks, Bob. Thanks, Karina. Yeah, they are very reliable. When we look at this, the sensitivity and specificity are very high. Sensitivity of 100% or near that, and specificity being 98.6 to 99.6, meaning that they're very reliable in helping us to determine how many people have actually had the disease and how many people have an immunity towards that. And being able to get our economy back and be able to get people back out into the world and back out into society, this is going to be very important information.
Dr. Crandall, $119. That's a pretty hefty price tag. Just given the reliability of this test, in your opinion, do you recommend it, or is there a cheaper and just as reliable alternative?
Well, I think if we go down the road, there will be cheaper studies. This is the best thing that we have right now for us. So if you're concerned, if you had the virus before, it's a good study to get. But I think we need to warn everybody, just because you had the virus once and you recovered does not mean that you're not going to get it again. So we're just starting to understand some of these problems and issues with people that have had previous exposure and now repeat exposure, and the fact that they might get ill the second time around.
Dr. Crandall, what do you recommend for people who have had coronavirus before? You're sending a warning. What do you recommend that they do, and maybe all of us do, to prepare and to boost our immune systems?
Well, the best thing is prevention, of course, social distancing. This virus is not leaving us. It is here, and it's going to be here for years, and we're just going to have to live a different life. We need to have better immunity. We need to be built up, and we can do that in the natural with diet and with exercise and proper sleep and low stress and staying up to date on vitamins such as vitamin C, A, and D. We have to improve our immune system to fight this battle.
Dr. Baugh, let me ask you about the home test again. Is that something where I take blood? And most people aren't used to taking their own blood.
Yeah. So the way the Quest Diagnostic is doing it right now, it does require a blood draw, and there are going to be some opportunities to be able to have tests truly in the home that require just a small pinprick at home. But right now, if I understand correctly, Quest Diagnostic is sending you a test. You have to go into a facility to be able to have your blood drawn. But that is the difference between the sort of the positive negative test that we had before, the qualitative test, versus now this quantitative test saying an antibody. You have antibodies in your system. Before, when we were just determining if you had the disease, it was just a swab in your nose, a little invasive but not bad. But this does require a blood draw.
Dr. Jonathan Baugh and Dr. Chauncey Crandall, we always appreciate your expertise. Thank you so much for joining us today.
Right now, we want to go to Kokomo, Indiana, where the Vice